After being told you have breast cancer, knowing what to do next can be overwhelming. And Seton is in the process of building this new breast cancer center designed to be a one-stop shop for those battling the disease. It's set to open early next year, and this month is National Breast Cancer Awareness Month. And surgical oncologist Dr. Rob Fuller is here with us this morning. Good morning to you.
Good morning. Thank you.
Of course, we just saw a little footage of that new facility. What is so special about this place?
Well, we're trying to integrate a lot of the care features that go into taking care of patients who have breast cancer, not just the imaging and the biopsy, the technical things that go along with getting a diagnosis, but also more of the comprehensive care if you get a diagnosis. What do you do then? Is there a support group that can help get you through all the stages of treatment? We call those people nurse navigators. Those people are there. Dietitians are there. Conference centers so that people can meet weekly to talk about women who have breast cancer. So all the things that go into diagnosing and treating women with breast cancer.
Instead of going from one facility to then being pointed to another facility and another facility.
Right, trying to streamline care, trying to integrate the care, and so much less bouncing all over town, trying to go from one step to another. Really have a lot of those professionals, a lot of those support services in one place.
And I know you preach this over and over, that early detection is key, and you hear the magic number for getting checked for the first time as a female is 40. Is that still the age?
For the vast majority of women, yes. It's 40 years of age. 95% of women are going to be over 40 if they develop breast cancer. But for women who have a positive family history, moms, sisters, daughters, with breast cancer, or have a unique or a certain genetic change, BRCA1 and 2, those women are at higher risk, and they ought to get screened more frequently and earlier.
Now, how closely should that relative be? I have a great-grandmother who died of breast cancer. Right. Is that much of a risk? No one since then.
Not as much. Usually it's first-degree relatives. So, again, moms and aunts a little bit, but in the models that we look at, it's mainly first-degree relatives, mom, sisters, put you at a little higher risk.
And, of course, you always hear about mammograms, and that's really the one and only test you hear about. Are there other ways to get checked, other things out there?
Sure, especially for women at high risk. Usually we'll use an MRI. It's a little easier. Younger women, mammograms are a little harder to interpret, so MRIs are a good adjunct. They help the radiologist look at a woman who's had a mammogram and interpret it a little bit better. Still, the vast majority of women are going to be well served by mammograms. If they're at high risk, consider earlier screening with an MRI.
And most insurances, I would assume, cover that.
They do. Screening is a big part of preventing cancer, and most insurance companies are going to cover that.
All right, Dr. Fuller, thank you so much for being here this morning.
You're welcome. Thank you.